one. Now remember, this time, the nerves that we are talking about are located up here. All right? Think about where the brainstem is located, and for the most part, all of them coming out of that area of the brainstem. So just like a nerve, okay, like we were talking about with the spinal nerve, they have reflexes. We're going to see the same thing with the cranial nerves. There are reflexes. The biggest one, the vagus. Look at that. Heart rate, blood pressure, respiration, digestion. Are we missing any system for the vagus nerve? What I'm trying to let you know is that the vagus nerve is going to have sensory, motor, parasympathetic effects on all these systems. We haven't gotten into the autonomic nervous system yet, but that next chapter, you're going to understand why this nerve is so effective on these systems. Well, maybe I should say, well, no, A. Okay? So, the rest of them, reflexes that can occur. They're going to be helpful in like turning our eyes, hearing the noise, having the touch on our skin, flashes of light, eyes tracking an object, ear muscles associated with the middle ear to move those ear bones, helping us chew. Think of all of these activities that are occurring in, for the most part, the special senses of the body. They're going to be extremely important in those special senses. Their reflexes are going to get interesting. We'll get into some of that when we get into the autonomic nervous system, and then we'll get into it when we're talking about the special senses. Now, some of the diseases and disorders that can come about with our central nervous system and the cranial nerves, some of these you've probably heard, okay? You've probably heard of an aneurysm, a stroke, a concussion, cerebral compression, when there's pressure being placed on the cerebrum, such as fluid on the brain, for example. One of the reasons that fluid on the brain can be so damaging is because of the pressure it's putting on the brain tissue. And it can actually end up creating situations where the blood flow is cut off, therefore killing the tissue, therefore killing the ability of whatever comes with that area of the brain. So this is the reason something such as a concussion can be so damaging.
You said that the blood killing the tissue in the area of the brain, will that spread over time in the brain, or is it just stay in that one area?
That depends. If they can go in and relieve the pressure, which sometimes they have to do, okay? Hopefully the blood store, they've done it in time so that the blood flow can be restored. But that's not always the case.
So if that area of the brain ends up dying, and
it's dead.
Is dead.
It's dead.
Or would it affect other parts? You know, like if you say, for example, like a part of your arm gets.
Right. Whatever the area of the body that part of the brain serves will be affected.
Yeah, but I was saying, like, say, like, for instance, your arm gets messed up, then you have to get it amputated because it will like affect the rest of the arm.
No, it wouldn't cut off the blood flow. It would be nerve damage.
Okay.
Now, what would make someone be like completely breathing?
It can be oxygen deprivation, but now there are different reasons why that can happen. You're going to see that they could have been like in a car accident. That one of the things that like when a person blacks out or whatever the case might be, they talk about that 5 minutes, 5 minutes, 5 minutes. Okay, you go past that 5-minute time frame, chances are you cut off all the oxygen to the brain, because that's dependent on the venous reserve that we have in the body. And that blood flow, once we cut off the oxygen, because oxygen is extremely important to the brain tissue, you cut that off and that tissue stops working. And so it has to be enough of the areas of the brain that have been cut off that it just doesn't function anymore. But now see, the primitive functions of the body come from the brain stem. So a person can technically be brain dead, but their body's heart is still beating. So some of the cranial nerve disorders. Well, anytime you hear the term neuralgia, neuron, okay, that has something to do with a nerve. Trigeminal, this one that has 3 branches, okay, this is one that's very common, okay, well, not very common, but more common than the others, is the trigeminal neuralgia, extreme pain, usually. Migraines. Now, lots of stuff goes on with migraines, okay? I can't identify all of it or understand all of it. Do I have them? Yes, okay? Anybody else in here ever had one? All right, not a lot of fun, okay? Lots of different reasons, lots of different causes. Not sure if they've ever identified any single thing. The facial palsy. Ever known someone who may have had Bell's palsy? Okay, one side of their face usually gets affected. If caught in time, this is a virus, the Bell's palsy. And this is actually a virus that you can get infected with, and it'll affect the nerves, and they usually end up having facial droop. The eyelid won't close, that sort of thing. And they can give like medications like the prednisone and stuff like that to try to decrease some of the inflammation and irritation and everything, but usually it has to just run its course. And the key, of course, is catching it in time. And herpes, simplex 1, is a cranial nerve disorder. People with certain, like with the herpes and everything, when it breaks out along the line of a nerve. That's where it breaks out, where the nerve is, which is really kind of interesting.
Simplex 2, is it?
Simplex 2, even though not associated with the cranial nerve disorders, when you break out, you're going to break out along the line of a nerve.
Isn't that kind of like acne in a way, or is it?
Acne is going to be where it's the actual glands. Now, when we say true acne, you know, the one that ends up getting all red and white and puffy and all that sort of stuff, that's actually one of your glands, one of your oil glands, that's gotten infected with some bacteria and other stuff. So, this I think is the end, yes, of chapter 14. So,